Chronic liver disease impacts about 1.5 billion people worldwide, and the most common form, 59%, is non-alcoholic fatty liver disease. Non-alcoholic fatty liver disease is caused by factors other than alcohol, such as obesity, high blood pressure, high cholesterol, and type 2 diabetes. Thinking of this disease in terms of fat accumulating in your liver, it may be apparent that having excess fat in a vital organ is not good. Treatment for this disease is lifestyle medicine. Eating a healthy diet and maintaining a healthy weight are crucial to managing this disease. Weight loss specifically can reduce inflammation, fibrosis or scar tissue, and fat in the liver. Weight loss and maintaining a healthy weight can be supported by regular participation in physical activity and exercise. This is supported by current research suggesting that exercise improves liver function. Both cardiorespiratory and muscular training improve health of people with non-alcoholic fatty liver disease. Physical exercise is a proven treatment for improving fatty liver disease. Physical activity reduces the risk of liver-related death, and physical activity reduces liver disease progression. Walking can be a great place to begin when it comes to being more physically active. Walking is a form of physical activity that is often easy to get started with because it is accessible and there are not many barriers to getting started. Walking can be done in a variety of safe locations, and no fancy training, gear, clothing, or accessories are needed to get started. Ultimately, all that is needed to get started is a good pair of walking shoes. This liver condition is often associated with other health-related conditions, including obesity, and walking is a safe and appropriate form of exercise for most people. In addition to the liver-specific benefits to physical activity mentioned earlier, there are many other benefits, including lower risk of all-cause and cardiovascular disease mortality, decreased risk of cardiovascular disease, hypertension, type 2 diabetes, depression, falls and fall-related injuries, adverse lipid profiles, and cancer, and improved quality of life, cognition, bone health, physical function, and sleep. Physical activity and exercise help with liver disease by being one part of a healthy lifestyle that can support efforts to lose and maintain a healthy weight. Here are some tips for getting started with becoming more physically active. Keep it simple and don't overcomplicate it. Sometimes thinking about exercise and physical activity can be overwhelming, and this causes inaction instead of action. Remember that there are many ways to be physically active, such as gardening, playing, walking, hiking, swimming, cycling, house chores, jumping rope, archery, and golf. And doing any amount of physical activity has health benefits. I love the current physical activity guidelines because simplicity is built within. For example, the guidelines state that adults should move more and sit less throughout the day. Some physical activity is better than none, and adults who sit less and do any amount of moderate to vigorous physical activity gain some health benefits. The thought of moving more and sitting less can be a great starting point for implementing a more active lifestyle. Think of ways for you to move more and sit less throughout your day and give it a try. Think in terms of taking one step at a time, and each and every step counts. It is also helpful to think about this. Bouts of any length contribute to the health benefits associated with the accumulated volume of physical activity. Sometimes we can be our own barrier to being more physically active because we think exercise must be a certain thing and last for a certain amount of time to be effective. This may be true, but it may not be the only way to optimize your health. For example, many people think you have to work out for an hour and be sore and sweaty to achieve any health benefits. But again, that is not the only way. Time is no longer a barrier because exercise does not only mean spending an hour at the gym, but rather you can walk for 5 minutes 3 times per day and do some body weight exercise throughout the day. The key is to get your body to work harder than it normally does. What can you start doing today to become more physically active? This is a great question to reflect on when getting started. Be realistic and remember that you are the foremost expert on yourself and that you are resourceful and capable of change. Don't set goals based on the ideals someone has created for you, but devise a plan based on your life, values, strengths, and enjoyment. Use the comment section to share how you will move more and sit less.